Okay, thank you everyone for joining us once again for this bi-weekly media availability. With me today, I have Dr. AnneMarie Pegg as well as Dr. Cami Kandola. I think everyone by now understands how these work, so I won't go over the ground rules and agenda here at length. Dr. Kandola and Dr. Pegg will both deliver some opening remarks, and then we will open the floor up to questions, should there be any from the media, which I'm sure there will be. We have a full hour blocked off here today, so we'll get to as many questions as possible. And to ensure that we have more than ample enough time to do that, I will pass things over to Dr. Kandola right away. Thank you.
Good afternoon. It isn't often that I get to share good news at these media events, so I'm going to start there. The community government and leadership team in Whati, along with all the residents, should celebrate their collective efforts to support one another during the recent containment order. The risk of COVID-19 spread within that community has dropped substantially. I have no intention of renewing the containment order in that community. Congratulations, Whati. Sometimes our smallest communities lead the way. The situation is different in Ndilŭ, and Ndilŭ, and Yellowknife. We have not reached the peak of the current wave in this outbreak. These communities account for 96% of the current active cases in the Northwest Territories. The risk of being infected with COVID-19 is highest in these communities. The additional restrictions put in place in Ndilŭ are there to stop the transmission of COVID-19 between the Klito region and Yellowknife. It will take a few days to evaluate the effectiveness of this new order. Given the current high level of risk in Yellowknife and surrounding communities, it is my intention to extend the gathering limitations public health order through to 11:59 p.m. on October 17. Some schools could potentially return to in-class learning on October 18 if COVID activity decreases. Additional details on return to classrooms will be announced next week. I want to prepare residents of Dettah and Ndilŭ and Yellowknife that some form of public health order will remain in place until we see a significant downward change in the number of daily cases in these communities. Capacity in our healthcare system is not unlimited. These public health orders are in place to slow the spread of COVID-19 to protect limited capacity. Slowing the number of hospital and ICU admissions protects health system capacity. 70% of people hospitalized in Northwest Territories were not fully vaccinated. High exposure settings, we're also observing waning of vaccine effectiveness. N.W.T's experience is that with close and prolonged contact with a person with COVID, even those fully immunized can acquire the infection. These are what we commonly refer to as breakthrough cases. It is really important for everyone to know that vaccines are still preventing the majority of infections that would occur if people weren't vaccinated. We know that the vaccine protects against severe outcomes of COVID-19. Getting fully vaccinated is the best way to protect yourself, your family, and your community. In response to waning immunity provided by the vaccine, we will be introducing a booster dose in a staggered way. Those who need the booster dose the most are prioritized. This means we've offered those in long-term care, those over 75 in outbreak communities, and frontline workers in outbreak communities. We've offered them the booster first. We're also offering all third doses to everyone who's immunocompromised in N.W.T, as specified by NTHSA. The season of Thanksgiving is upon us, and I want to take this opportunity to express my gratitude to the residents of Northwest Territories who have continued to follow the advice recommendations of my office. Thank you to my staff who have continued to go above and beyond in their public service. Thank you to frontline healthcare workers who provided support and care in challenging times to patients across the N.W.T. Thank you to the public health officers working to support the community of Betchoko and provide education on the new public health orders to ensure residents have up-to-date information on what is required to travel in and out of that community. Thank you to the many frontline workers in the retail sector who are working so residents can continue to have access to groceries, gasoline, and many other essential services and supplies. This weekend, if you are in a community with gathering limitations in place, please keep your celebrations to only your household. Connect with your family and friends virtually through video or phone calls. Across the Northwest Territories, avoid large gatherings. Wear a mask, follow the healthy habits recommendations to increase your level of personal protection against COVID-19. And these are difficult times, but together we will get through them. If you are in a position to help someone in your community, especially coping with restrictions, which aim to help everyone, please do so. I encourage you to reach out to your network and find someone whose day you can brighten and improve. If there are community members you are thankful for, I would encourage you, in the spirit of Thanksgiving, to reach out to them directly and share your thanks with them. Thank you very much.
Thank you, Dr. Kandola, for those opening remarks. I will now pass the floor over to Dr. AnneMarie Pegg.
Thanks, Jeremy. Just checking that you can hear me all right.
We can, yes, thank you.
Perfect. I wanted to focus my opening remarks today on our acute care services to provide an update on the Stanton Territorial Hospital and work being done to address the oxygen supply, and to update on our work to ensure continued care and services for Northwest Territories residents in Alberta, our key partner referral site, where we send people who require care that they cannot receive in the N.W.T. First, I'll speak to issues regarding oxygen at Stanton Territorial Hospital. The most important thing to note is that we have not, now or at any point, exceeded the capacity of the oxygen delivery system at Stanton, and we have been able to provide oxygen for ventilatory support to every patient who has needed it. A root cause analysis on the source of the issues is still underway. After testing, we know that the oxygen generation is run as intended and at full operating capacity, with manufacturer expertise being brought on site to do the assessments and testing and replacement of key components. The volume of oxygen required to treat acutely ill COVID patients is considerable. As worldwide experience with this illness expands, changes to best practice approaches have also evolved. For example, the use of these high flow oxygen devices to delay intubation or attaching a patient to an artificial breathing machine require a much higher volume of oxygen than we had planned for at the outset of the pandemic. This presents a challenge, but we have dedicated significant effort to address it, and the solutions underway include the following. Bedside oxygen concentrator devices that can be chained together to feed ventilator devices in a modular way, independent of the facility oxygen system. Tank-based oxygen supplies on hand and logistical support to regularly restock these to ensure that we can also use these to provide to patients if needed. And the examining of a modular oxygen concentrator device specified for modular field hospitals, which is an option that would increase the capacity for oxygen generation at Stanton to 4 times its current capacity. All of this work is being done in partnership with Dexterra and the partner Department of Infrastructure, and our outreach has included the federal government and the National Emergency Strategic Stockpile. The best way to preserve our oxygen resources is to limit the number of people who need them. Limiting the number of COVID-19 infections is critical. Following the public health measures and getting vaccinated, if you've not already done so, are the tools that we have to limit the number of people who require these services and ultimately preserve our capacity to provide care to ill Northerners. Building on this, I will provide an update now on patient care in Alberta. There's an ongoing impact due to reduction of services in Alberta for non-urgent and elective procedures, and this is likely to continue to impact Northwest Territories residents who would normally be traveling to access these services. We are happy to see measures being put in place to reduce the spread of infection in Alberta, and we're glad and hoping that these are continuing. We understand that there may be concerns after seeing the news in Alberta regarding case counts and healthcare capacity. I'd like to assure you that we're working closely with our partners in Alberta to ensure that our residents maintain their access to care. Regular communication is ongoing with Alberta. They continue to accept our emergency and critical care patients and have committed to continue to do so. If there were any scenario where Alberta would not be in a position to accept an N.W.T patient, transfer to another jurisdiction would be managed in collaboration with Alberta and any receiving province or territory. Finally, I would like to express my sincere thanks to the entire NTHSSA staff team. Time and again, your commitment to patient care, even though you are exhausted and worried yourselves, is admirable. And to the residents of the Northwest Territories who continue to follow our public health measures, residents who have been vaccinated, residents who continue to support others to do the same, you are protecting yourselves, your families, your friends, and your communities. We cannot manage this response without your efforts. Thank you.
Great. Thank you, Dr. Pegg. We will now move on to the question and answer portion of our briefing today. I'd ask, as always, that everyone who is not speaking to please keep themselves muted until they've been called upon to ask their question or answer one. So we will run through the list of media one by one here as per usual. I will call upon you and you will be able to ask 2 questions to either Dr. Pegg or Dr. Kandola. So to kick things off, first here, I will ask Megan Brackenberry with Cabin Radio if she has any questions for either of our participants today. Megan, are you there?
Yes, hello. Thank you. Can everyone hear me?
We can, yeah.
Thank you. Thank you everyone for making the time to speak with us today. My first question is very general, but I just want to know what the DNWT stance on COVID-19 passports and requiring vaccination for certain public spaces is, and when/if this might come into action.
As we only have Dr. Kandola and Dr. Pegg on the line, I'm not sure we're going to be able to answer your question in the way you may want, but Dr. Kandola, I'll pass things over to you to see if you're able to address Megan's question at all.
So we know the federal government just recently announced their requirements, especially on commercial air travel or train travel. And so I know that people are working diligently on looking at vaccine credentials. Right now, my focus is on the outbreak response, but this work is underway and it's something that we will be willing to explore, and we'll announce more when we get more information.
Thank you, Dr. Kandola. Megan, did you have another question? Or would you like a follow-up to that question?
Yes, thank you. I'm just wondering, I know that Dr. Kandola, you had said that you are planning to extend the health orders in Yellowknife, Dettah, Ndilŭ, and Dettah. I'm wondering if those orders might come, like if you're looking at further restricting gathering limits, such as shutting down businesses or changing measures in any way in that regard.
Dr. Kandola?
At this point, we're just continuing the current order. We're not changing any of the pre-existing gathering limitations of the order that's in effect. We are pleading with Yellowknife and Dettah, please, if you have to isolate, safely isolate. If you're symptomatic or you're sick, get tested. If you're close contact and you need to isolate, isolate. And if you can get vaccinated, get vaccinated. Together, we can get through this, we can get to the peak and get to a point where we can start opening up gatherings. Right now, N.W.T, our active rate of COVID infection is 7.5 times the national average, but we are the highest in Canada. And unfortunately, the bulk of the cases, over 90% of the cases, are Yellowknife and Ndilŭ. So those 2 communities, we're just looking at what's going to happen in the next 12 days and hoping that we reach peak and we'll get a downward trend. That downward trend relies on testing, isolating, and following the public orders. Thank you.
Thank you for that, Dr. Kandola. And I will let everyone know we are moving quite quickly here today, so we most likely will have an opportunity to go back around for additional questions. So Megan and others, just something to keep in mind in case you have additional questions. We'll do our very best to get back to you and allow you time to answer those. Next on my list, I have Luke with CKLB. Luke, do you have a question for either of our participants here today?
Yeah, thanks, Jeremy. I'm not sure if this can be answered here, but I just had a question on enforcement. I was wondering, with Thanksgiving weekend coming up, if there's going to be additional enforcement in the areas that do have restrictions in place.
Dr. Kandola, do you have any insight on that?
So we're actually someone has if someone can everything on mute there. We are looking at actually increasing enforcement capacity as we speak. I can pass this on to COVID Secretariat, but given the restrictions and the additional orders specific to Bay Choco, we compliance and enforcement are looking to increase the capacity.
Great. Thank you, Dr. Kandola. Luke, do you have a follow-up question or any additional questions you'd like to ask to either Dr. Pegg or Dr. Kandola here today?
Yeah, just with the cases, so they've continued rising since the restrictions went in place. I was just wondering if there's any theory of why that is, that they're going up so much when there is no public gatherings allowed, if people have been likely breaking restrictions, or yeah, if there's any other theory for that. Thank you.
Dr. Kandola?
So it's okay, we're on mute. Okay. It is interesting now. One of the an area that we saw an increase in transmission was Bay Choco, Yellowknife back and forth as people visited their families. They may not know they're infected, or breaches in compliance in a number of areas. We have we think the best way for Bay Choco and Yellowknife to reach the peak and to have more recovered cases and active cases is to isolate separately from each other, so they're not constantly cross-infecting new households. And then what we're also seeing is when one person in a household gets infected, the entire household tends to get infected. So you can start with one person and end up with 5 or 6. We're also seeing that we're seeing support staff working with people with COVID are themselves getting infected, and again, households are being infected. And then we plain have cases that have no link to any known cases. And so the gathering order and the Bay Choco order was to limit further contact and transmission. And so it's has because the gathering order was just put in place on Monday. As the week progresses, I'm hoping to see in both scenarios start to see a drop in cases.
Great. Thank you for that, Dr. Kandola. Moving things along here, up next on my list, I have Thomas with Media N.W.T. Thomas, do you have any questions for our participants here today?
Good afternoon. Can you hear me well?
Not well, but we can hear you.
Okay. Perfect. I'll do my best. Thank you for being here today. My only question would be, have you noticed an increase in the vaccination rate in the past few weeks, maybe due to this outbreak?
Dr. Kandola, are you able to speak to that for us here today, please?
So we always see an increase in vaccine coverage, and so at the current time, if you look at everyone who's eligible for vaccine, 83% of our population 12 and older have received 1 dose, and 78% are fully immunized. And we did start to see an increase in vaccine numbers when we put that Bay Choco order in place. Other incentives to increase your vaccination is A, it's the best way to protect yourself, but B, the government of Canada has introduced their own commercial air and train travel restrictions, and we also last week announced mandatory vaccination, especially for the health, education, correctional facility and frontline workers, and that requirement is due November 30th. So there's lots of reasons to get vaccinated, but some of them are going to restrict what you can do and can't do in the future. So basically get vaccinated. Vaccine numbers are going up, but we need them to go up higher.
Thank you, Dr. Kandola. And Thomas, I noticed, I know, sorry, that you mentioned you only had one question for us, but I did want to give you the opportunity to ask a follow-up question if you did have one.
No, thank you very much. I'm good.
Okay, no problem. Thank you very much. Up next, we have Ethan Butterfield with NNSL. Ethan, do you have any questions for Dr. Pegg or Dr. Kandola today? If you are trying, oh, Ethan has put a question here in the chat that I will get to shortly, but I will move things along while we give him an opportunity to place those questions there. Eric Bowling with NNSL as well. You're next on my list. Eric, do you have any questions for either of our participants?
Yeah. Can you hear me?
We can, yeah, thank you.
Excellent. Yeah, so my question pertains to the case in Nunavik, positive case from October 1st. My understanding is that there was a notice issued and given out to residents at the Aurora College campus in town on October 2nd. So I'm just wondering why it was decided to not just release the information to the public then and took till yesterday to get that information out. Thank you.
Thank you for your question, Eric. Dr. Kandola, are you able to speak to that?
So this information we receive many tests every day. Some are rapid tests, and some are PCR tests. This sometimes we get tests after hours on Friday. So after a certain time on Friday up until 9 a.m. on Sunday, we don't do public health updates. And the information was followed up around this positive source, this positive case. And the Office of Chief Public Health Officer doesn't release exposure notifications if we can determine contacts. So we don't always, every single case doesn't get an exposure notification. And in this scenario, we did not release exposure notification from our office. And the information around that case was counted after Monday 9 a.m., but it was counted in yesterday's tally. But the case was discussed with our office and responded to, isolated, and properly followed up immediately on Friday. With our public health updates, occasionally there'll be a case that be announced the next day, but it will eventually be captured, and not all cases get exposure notifications. Exposure notification from our office are uploaded on an official site, a COVID website. If your organizations choose to do an exposure notification outside of the office of the Chief Public Health Officer, it's not something we can control, but this was not issued from our office.
Thank you for that clarification and information, Dr. Kandola. Eric, do you have either a follow-up question or another question you'd like to pose to either Dr. Pegg or Dr. Kandola this afternoon?
Yes, please. Okay, keep bearing in mind that the day before this positive case on October 1st, there was a large march in town with several estimates of over 200 people in very close quarters. So I'm just wondering what kind of assurances you can make to us that there aren't any other cases like this that we're going to find out about as the paperwork catches up. Thank you.
Sorry, just to clarify, your question is that what assurances can we provide or Dr. Kandola provide that there will be no additional cases? Is that correct?
That there's nothing else like this happening behind the scenes that we should be aware of, just so people know whether or not they should be isolating, taking extra precautions, that sort of thing, because the community's been fairly untouched by this so far. So people are concerned. That's all.
Dr. Kandola, do you have a message that you would like to deliver to the folks in Nunavik that Eric speaks about?
So we look at every case. We actually have over 1,300 cases to date since the start of the pandemic. We do public health risk assessments on the case. We look at the exposure timelines, look at where they could be communicable, and then we make decisions based on that. And so that's all we can say. And if there was a link to high-risk gatherings and that would come out of exposure notification. But every case gets followed up. Every case gets a public health risk assessment, exposure timeline, and then we can determine the communicable period, who that person was in contact with, and who is at risk. And typically, if there's a risk to the public, we don't notify the public on people's contact tracing.
Thank you, Dr. Kandola, and I hope that answers your question. Eric, I will go back to Ethan with NNSL, who has provided his question here in the chat. I will read it aloud, and then Dr. Pegg asks you to respond as he's posed this question to yourself. Ethan asks, regarding N.W.T residents that are headed to Alberta for emergency surgeries, it was mentioned that they would be moved to another facility if Alberta could not allow them. I've heard from those that are in desperate need of emergency surgery that have had them canceled by Alberta. What is, if possible to say, the estimated time frame on those who need surgeries going to a new provincial medical facility? Dr. Pegg, are you able to address Ethan's question for us, please?
I can try. So the definition of emergency is not necessarily easy to pin down, and certainly the unfortunate reality in Alberta for a period of time has been that surgeries that are not essential to the preservation of life or limb within the next 3 days, the vast majority of those have been canceled. They are looking at how that backlog can be addressed once the public health measures take effect and hospitals under less strain. But they have, in a number of cases, applied a fairly narrow definition of what constitutes emergencies. They have been able to continue with cancer surgeries to a certain degree. There was a conference that I believe is available from yesterday, but there have been a number of surgeries that have canceled. When we speak about N.W.T patients potentially being sent to other jurisdictions, that would be, again, a hospital-to-hospital transfer in the situation where Alberta was no longer able to take those very critical patients that we would be looking at transferring out of a hospital in the N.W.T. So there are certainly a number of people who have had important surgeries canceled, postponed, deferred, and that's really stressful and really distressing. And we're working with our partners in Alberta to look at what the options for those people are. When we look at transferring people to other jurisdictions, we would be looking at the very dire situation when Alberta is also no longer able to take those patients, and we would look at transferring from a hospital to another hospital in a jurisdiction, but as a hospital-to-hospital transfer.
Thank you, Dr. Pegg. Moving along now, we have Chantel with the CBC. Chantel, do you have any questions for our participants today?
Good afternoon. Yes, I do. Can you talk?
N.W.T, just like you kind of knew about, we were really privileged to get our allotted doses for Moderna for 75% of our population in the first 3 months of 2021. And we started with our high-risk population in January. We had very strict 4 to 6 week interval as per the manufacturer's recommendation. So we were pretty much finished with a high-risk population by early to mid-February. And then for the general population, it was around March. So what we're seeing as time goes by, and typically it starts around 5 months after the second dose in this scenario, and is that we're starting to see more and more breakthrough cases. And this is what something Israel saw, UK saw, is that we initially start to see breakthrough cases, an increase in breakthrough cases as time goes on, and sometimes we see a breakthrough in severe health outcomes. The fortunate thing is the vast majority of our cases and the vast majority of our severe health outcomes have been the non-fully vaccinated. And where we've seen this breakthrough cases is people who've had ongoing close and prolonged contact with people with COVID. So if it was a household member that had COVID, or if they were working at a shelter, or if they're working at a healthcare facility, that we started to see this waning immunity. Going forward, we recommend that everyone get vaccinated, but we are looking at booster options to decouple this waning immunity from severe outcomes. So we focus first on providing a booster dose to all long-term care facility residents, 60 and older. We then provided a third dose to all those who are immunocompromised. And in the outbreak areas, which specifically is Beit-Choco and Yellowknife, because we have provided a boosted dose for 75 and older in these populations. But because of frontline workers tend to be healthy, but because of our staffing shortages and not the ability to have people take off time of contact or a case, we've also provided boosters for frontline workers in Beit-Choco and in Yellowknife. And so this is the start of our prioritization of boosted doses.
Thank you, Dr. Kandola. Chantal, do you have any follow-up questions or an additional question for either Dr. Pegg or Dr. Kandola this afternoon?
Yes, I do. Thank you for that response. What options are available for people who need to isolate away from home? We're hearing that hotels are filling up.
Dr. Kandola, can you please address that question?
These options is through the COVID Secretariat. COVID Secretariat is a lead in providing isolation for medically advised, and so they have a list of designated isolation facilities in the regional hubs and in some specific communities. So right now, COVID Secretariat uses 3 hotels: Quality Inn, Chateau Nova, and the Explorer Hotel. And as people recover, openings are made available. So if we have less active cases and more resolved cases, we have more openings in these isolation facilities.
Thank you, Dr. Kandola. Next, we have Claude with Radio Canada. Claude, do you have any questions for either Dr. Kandola or Dr. Pegg today?
Yes, Can you hear me?
We can. You're quite faint, Claude. If you're able to speak up, that would be appreciated, but we can hear you.
Oh, okay, no problem. I'll try to speak a bit louder. Just a question, follow up to what Chantal just asked regarding waning immunity and third booster dose. Dr. Kandola, you spoke about an actual calendar or agenda on how to deploy booster shot. I was just wondering, is there any plan or is there any discussion going either on territorial or national level for a third booster shot for general population?
Dr. Kandola?
So we're not specifically looking at the general population right now. Like where we're focusing is that the vaccines work in preventing serious outcomes, but looking at the high risk populations where a booster would be beneficial. So that's the elderly, immunocompromised, the elderly specifically living in long-term care facilities, and frontline workers who take care of high risk these populations more from a health system capacity versus a severe outcome capacity. As we progressively further and further from our second dose, or 6 to 8 months from our second dose, the decision whether we provide that to the general population is something that is being reviewed or is on the agenda for the National Advisory Committee on Immunization. For myself, I did decide outside recommendation as more of a directive that given the rate of community transmission, the rate of activity that we're experiencing in Yellowknife and Betchoka specifically for these communities, that we need to target the 75 and older, and we also need to target frontline workers. Thank you.
Thank you, Dr. Kandola. And I will remind everyone here today that if you do have additional questions or any questions we're not able to answer, Chantel, like the one you asked previously, you can write to COVID_comms, that's COMMS, @gov.nt.ca with any follow-up questions, or if you need additional information and clarity on anything that Dr. Kandola and Dr. Pegg may not be able to give a robust answer to today. Cloud, did you have any additional questions before we move along?
Yes, just one. Considering what's going on in the Northwest Territories right now, do you think that the situation here could become some kind of a beacon for the rest of the country regarding waning immunity and the outbreaks we have?
Absolutely. I think N.W.T can pave the way. I feel the N.W.T were 8 to 12 weeks ahead where other provinces could be in terms of if there's any possible waning immunity, because they provided their doses a lot later, even for their elderly and for other high-risk people. We were absolutely fortunate to get a full allotment in the first 3 months. And we also had that 4 to 6 week schedule. I know in other most jurisdictions they had to prolong that, prolonging the interval between the first and second by some time, but eventually their waning immunity will be seen, which is what we see in the UK. And we are obligated. I'm obligated as Chief Public Health Officer, looking at what I'm seeing in N.W.T to relay that information to all the other provinces and territories, which I have and which I'll do on an ongoing basis.
Thank you for that response, Dr. Kandola, and thank you for your questions today, Claude. We do have another question here from Kevin with True North FM. Kevin asks, Dr. Kandola, it's been almost a month since public health orders were first put in Betchoka and Yellowknife, and yet the case count hasn't gone down. In fact, it has gone up by a decent amount. Is there a number of cases either community would have to hit in order for a lockdown to be considered? What is the plan if things continue to get worse? Dr. Kandola, can you please address Kevin's question there?
So Betchoka is in lockdown and they've had additional travel restrictions. One of the things that we look at in the community in Betchoka, they have one of the lowest immunization coverages for fully immunized, and practically half the population is not fully immunized. The faster we can immunize that population and the quicker we can isolate cases and their contacts, the better the impact on decrease in the interval.
Thank you, Dr. Kandola. That brings us to the end of the list that we have here in front of me. So we do have about 20 minutes left in today's briefing here. So we do have 20 minutes left to answer additional questions here. So I will go back through the list again to see if others have additional questions. So Megan with Cabin Radio, we will start once again with you. Do you have any additional questions this afternoon?
Yes, thank you so much for taking another question. I'm just wondering, I know Dr. Kandola, you had said that it's possible that schools could return in person October 18th if the COVID case count drops, sorry. But I'm wondering if you can elaborate on what you would have to see, maybe in terms of the case count numbers before allowing schools to reopen in person.
Dr. Kandola?
I would have to say consistent drop in new active cases in Yellowknife, and which there was a point when we looked at the SAW2 where we saw there was the number of new active cases start to decrease, and then they start to be separated, and the number of resolved cases start to outpace the number of active cases. So it doesn't have to be to a 0 active case level, but there has to be some kind of indication that we have reached the peak and we've consistently going on a downward trend, and that we have a good handle on active cases, their isolation, and their contacts. And so what we would look at opening the orders and allowing some schools, such as middle and high schools, to open up first because they have they're eligible for immunization. And if we continue to see a significant downward trend, to delay by a bit of time the elementary schools, because that's where we anticipate we would get the largest school outbreaks. And so it's going to be a consistent downward trend in active cases in Yellowknife. Right now, we've seen a consistent upward trend in active cases. I wish it wasn't so, but we have put in place additional orders, and we have recently put in place that more restrictive containment order where it's no visiting at homes. So let's every day continue to see if we reach the peak and start going downwards. Thank you.
Thank you, Dr. Kandola. Megan, do you have any additional questions for either Dr. Pegg or Dr. Kandola?
I'm good for now. Thank you so much.
No, thank you, Megan. Luke with CKLB, do you have any final questions for Dr. Kandola or Dr. Pegg here today?
Yes, I do. Just on the exposure locations, I see there's pretty regularly new ones out every day to pretty much every place that's open in Yellowknife. I remember previously you said, Dr. Kandola, you said that everywhere in Yellowknife was considered an exposure location. So why even bother, releasing these locations if they're so regularly and so all over the place? Thank you.
That is a good question. So initially, when we were experiencing primarily the outbreak in the underhouse population, it was extremely difficult, and we had such high numbers that to get any kind of exposure notification, because they'd been everywhere and anywhere, and I mean, we couldn't always get a reliable history. So we put that, consider any place to be an exposure notification. But lately, because the shift is a downward trend from the underhouse population, and we're getting it more mainstream, more into families, more into different populations, they are giving a more precise history of times and location. And it's because we have less and less where it can be anywhere and everywhere. We're able to give much more detailed exposures. One of the things that people have to understand is that everyone's at risk. Like when you look at where people are going, it's everywhere and anywhere. And so I really do caution people to wear your masks, to have small size gatherings, follow the orders, and stay at home and isolate if you're sick or if you have COVID. It's important because we don't know who has COVID, who hasn't. And that's what the exposure notifications are showing, is that these are people who had COVID and didn't know, weren't aware of it, but they were infectious and communicable in that period. And so it's just an eye-opener to the rest of Yellowknife that, let's suppose you did get COVID and you're trying to scratch your head, you can go look at the exposure notification, and if you were in a facility or in a place in the right timeline, at least you can make those links as well.
Thank you, Dr. Kandola. Luke, do you have any additional questions?
Yeah, just one last one for just a bit of a clarification. Just for the Betchico travel restrictions, for proof of vaccine, like are people just showing their vaccine record, and are they just able to get that at like the health center in Betchico?
Are you able to answer that for us, Dr. Pegg?
Yes.
Okay, go ahead.
Oh no, go ahead. Go ahead, Dr. Kandola.
Oh, sorry, because it was in my order. I apologize. Basically, we just need verbal consent for the public health officer to review the proof of immunization. As you recall, we do have travel restrictions, self-isolation orders for coming into N.W.T. So we have a way of validating people's immunization for verbal consent. So they don't need to email NTHSA and get a hard copy. So we're using the same process we do for people coming into N.W.T. from out of territory for the public health officers with the same delegation of powers. Use the same process to get a verbal consent and check someone's proof of immunization.
Thank you, Dr. Kandola, and thank you again for joining us today, Luke. Thomas with Media N.W.T. Thomas, do you have any final questions for Dr. Pegg or Dr. Kandola?
No, I'm good. Thank you very much.
Thank you, Thomas. Moving along, Eric with NNSL. Eric, any final questions for us today?
Yes, please. But this is kind of, I guess, a worst case scenario type question, but I'm just trying to get a picture of what the contingency plan is if the outbreak manages to make it over the airspace and get up here, and we actually have to start hospitalizing people if they with COVID cases. What is the capacity at the Nunavut hospital, or is it a case where people would be flown down to Yellowknife? Just kind of curious what the contingency plan is for in the event our luck runs out up here.
Dr. Pegg, can you please provide us with some insight there?
Yeah. So the territorial pandemic plan, the initial stages for hospitalization of COVID patients does indicate that as long as there is capacity in Yellowknife, that COVID patients will be cared for in Yellowknife. So initially, there would be a transfer of patients from Inuvik and the region to Yellowknife if they needed hospitalization for COVID. In the later stages of the pandemic plan, there is planning for hospitalized COVID patients of a certain stability to be treated elsewhere than Yellowknife. But again, that involves an escalation of the pandemic plan, and that would be done in collaboration with the Territorial Physician Executive Committee and the rest of the acute care planning team, the NTHSSA and the OCPHO pandemic response team, looking at when we would escalate that. But for the moment, the capacity and the plan is that hospitalized patients will be transferred to Yellowknife.
Thank you, Dr. Pegg. Eric, do you have any final questions?
Yeah, just with that same headspace in mind. We have the wastewater monitoring system in place up here, I believe, if I'm correct. I might be incorrect on that, but my understanding is it's in place. I'm curious what the turnaround for that is. Like, how long does it take? How far back, or how many days does it take for us from getting a wastewater sample to knowing if there are active cases of COVID? That's it. Thanks.
No problem. Thank you. Dr. Kandola, do you maybe want to give us a quick rundown on how the wastewater signaling program works?
So basically, different communities collect a different amount per week. So with Inuvik, the last wastewater sample we got started on September 30th and ended on October 4th, which would have been Monday. So the results would have been collected and flown down to Yellowknife, analyzed yesterday, and reported pretty much within a 24-hour period of arriving. But the samplers, the audit samplers, because we have 2 in Inuvik, and I think it's about 50% of the population, is they stay in place and they collect continuously, and it's that continuous sample over several days that is sent. So the end of the data, the last one was October 1st, but the first date started with September 30th. So it's over a long period of time, and then once it's sent down, it's pretty much read and reported within 24 hours, but it's for that full duration. So if we do get a positive, it could be any time between September 30th and October 4th. And so I believe in Inuvik, we collect maybe twice a week, but it gives us a good idea of if anything is occurring in the wastewater, sometimes before people even present and know that they're COVID positive. It's an adjunct tool, but it doesn't tell us how much or how many. And because it misses about 50% of the population, you could still have COVID positive cases and not pick it up in the wastewater.
Thank you, Dr. Kandola, and thanks again for your questions today. Eric, next on my list, we have Chantal with CBC. Chantal, do you have any final questions for Dr. Pegg or Dr. Kandola this afternoon?
Yes, I just wanted to make sure we understand clearly if you meant waning immunity in general or waning immunity in non-fully vaccinated.
Do you mind providing just a quick bit of additional context there, Chantal?
Yeah, if you can clarify when you're talking about waning immunity, are we talking about fully vaccinated, partially vaccinated, non-fully vaccinated?
Okay, thank you. Dr. Kandola?
So if you only got one dose of the vaccine and you never got a second dose, definitely you would have waning immunity, because the whole purpose, that's a priming dose, and the whole purpose of getting the second dose is to boost your immune response. So unvaccinated have no immunity unless they've had COVID infection before. Then it's post-infection immunity. One dose vaccination, they can develop good immune response within the first 2 weeks, but the immunity wanes over weeks and months. And that's why we recommend having the second dose, which is the boosted dose for the priming dose. After the second dose, typically around 6 to 8 months, you start to see a waning immunity or a drop in antibodies for those people who receive the full vaccination.
Thanks for the clarification. Thank you.
Thank you, Dr. Kandola, and thanks again, Chantal. Finally, we have Claude with Radio Canada. Claude, you will take us to the end of today's briefing. Do you have any final questions for Dr. Kandola or Dr. Pegg?
Nope, I'm good, thanks.
Okay, great. Well, I will leave things there. Thank you again, everyone, for joining us this afternoon. Thank you for all of your questions, and thank you, Dr. Kandola and Dr. Pegg, for your remarks and thoughtful answers to the aforementioned questions. So we will bring things to a close now. Thank you very much.